Hello and greetings from Bronx, New York. This is Dr. Ronald Wharton at Montefiore Medical Center, and I thought I would show you an interesting Doppler and see if you could figure out where this Doppler came from in the study. So if you look at the first slide, you see a continuous wave Doppler signal with both a dense systolic and almost as dense diastolic signal. And I thought we would look at the 2D images and see if you could figure out how this signal arrived on the echo. So here is a parasternal long axis 2D image. You'll notice that there is a bioprosthetic mitral valve, left ventricular systolic function and right ventricular systolic function grossly look okay. Aortic valve appears to be opening normally. Mitral leaflets appear to be opening normally. If you look at the next slide with color, you can see that there seems to be laminar flow through the aortic valve. Doesn't seem to have any significant aortic regurgitation, none at all really. And typical flow pattern through the mitral bioprosthesis. Again, no MR seen in this slide, in this image. Just showing you all of the valves. If you look at the next slide, we're at the short axis of the aortic valve level. You can see here flow in and out of the pulmonic valve with small amount of pulmonic insufficiency, it would appear. The leaflets appear to be moving normally. The leaflets are thin and easily mobile. In the next slide, we have a slightly off-axis view of an apical four-chamber view. The left atrium is somewhat dilated. That's not surprising considering that there's a mitral bioprosthesis. And the tricuspid valve leaflets look normal. In the next slide, I'm showing you color flow through in and out of the tricuspid valve. Doesn't seem to be anything particularly alarming here either. So you've now seen 2D and color Doppler of all four valves. Here again, you can see a apical long axis view with the left ventricle and the RVOT on the right side. So how do we explain the Doppler? Well, remember, when you look at any Doppler signal, what are we looking at? We're looking at the velocities, the density, the timing, the contour, and obviously any signal that's on the other side as well. So we have a dense systolic flow that seems to be throughout the entire systolic cycle that's peaking at 3 meters per second, and then there's a pan-diastolic flow with a peak velocity of 2 meters per second. And remember that the velocities of flow have to correlate with typical pressures that you would expect inside the cardiac chambers. Well, what could this be? Well, you can get pulmonic stenosis with a systolic velocity of 3 meters per second. That's not particularly surprising. And you can get some pulmonic regurgitation with velocities like what we have here at 2 meters per second. But there's a problem here. If there were PS and PI, first of all, we would see it on the color Doppler. There was really no turbulence to the pulmonic valve. The pulmonic valve opens up nicely. But second, pulmonic stenosis would be going away from the transducer, and pulmonic insufficiency would be going towards the transducer, and that's not happening here. So that doesn't make sense. And then, of course, as I said, the pulmonic valve looks normal on the 2D imaging. So what else could this be? Well, it can't be aortic. The velocities aren't compatible with any aortic pathology. One could also say that's true for mitral and tricuspid valve as well. And then, of course, we looked at the valves. The valves looked fine. The aortic valve looked fine. The bioprosthetic mitral valve looked normal. Aortic valve looked normal. So you wouldn't be able to explain the Doppler profiles on any of those valves either via 2D imaging or via the velocity profiles that we see. But take a look at the 2D images one more time. This is the parasternal long axis with color now just slightly moved off away from the mitral valve, a little towards the center of the screen. This defect that you could see the color going in and out of was actually apparent on the 2D images all along. I just didn't bother to point them out to anybody because I was concentrating on the valves. Take a look at that. There seems to be flow in and out of that defect. In fact, if you go to the next slide, which is now a color shot of the apical long axis, which you saw earlier, you can see to and fro systolic and diastolic flow coming in and coming out. And in fact, on the next slide, you now have the same Doppler image as you had before, except now I've shown the 2D guided image above where initially I had blocked that out. So you can see where this is in fact coming from. It's not coming from a valve at all. There is an inferolateral pseudoaneurysm. Now, how did this happen? Well, sometimes when you operate on the mitral valve, you can ligate the left circumflex artery, and patients can have these for years and be completely unaware of it, completely asymptomatic, and this can sometimes be detected on a routine transthoracic echocardiogram as a consequence of surgery that happened a long, long time ago. And fortunately, in this patient, the dam never burst, as it were, because if you see a pseudoaneurysm, one has to worry about the potential for acute pericardial tamponade, which doesn't usually bode well for patients. So, take-home lesson, not all Dopplers are from valves, and I just thought you'd find this as enjoyable as I did and educational. I've seen pseudoaneurysms before, but never one where the flow velocities were this high and where the pseudoaneurysm were quite this large. My understanding is the patient's doing quite well. I hope you enjoyed this. And again, this is Ronald Wharton from Montefiore Medical Center, Bronx, New York, for theheart.org on Medscape Cardiology. And thanks for tuning in.